we're here at the ASH annual meeting, which is always very exciting, especially in blood cancers, where the latest and greatest clinical data comes every year, and I'm always impressed with the way in which this little buzz happens between patients and between the scientists, and the energy that goes out of this meeting back into the clinic. So I'm so happy to be a part of just this event. And I think when I think about the data that's been coming out of this particular meeting, I'd like to just have the listeners think about really two different aspects of it. Number one, I think about the science, and we are at a point now where we can be so personalized in care. So we can get down to the genomic level and really what's happening on your cells to help us think about how we could treat you as a person better and your cancer better. So the most important thing around that is to make sure, so listen to me listeners, is to make sure that you are appropriately tested. And the way in which to do that is to have a full conversation with your healthcare professional about your interest in being tested, and make them aware that you have this knowledge that there is such a thing as personalized medicine, and you think that if you are fully tested that you are able to work with them to come up with a treatment plan that is really the best treatment plan for your own personal needs. So when I think about the science coming out of the meeting, the most impactful thing for patients to think about is, number one, be tested so that your treatment plan is as personalized for you as it can possibly be. The second thing that I think about related to the science coming out of this meeting is the whole idea of patient and physician communication. And there is nothing that really is better than having a good dialogue with your physician, your nurse, your care team about really what's important to you, so that they know how to map your treatment plan in a way that will have you most satisfied as you think about living the best life that you can with your cancer. So, in addition to that upfront conversation around, have I been tested? What are my options? What do I need to know about side effects and how well the agent will work? Getting really to that level to say, this is what's important to me in my life, and let's talk about how we create a plan alongside of that. And then once a treatment plan has been established, if a patient has any symptoms or side effects that they start to feel is interrupting with the way in which they're living with their day-to-day life, making sure to have a conversation with their healthcare professional about that. And I'd like to sort of emphasize that we know from our research at the cancer support community that sometimes patients don't always tell the healthcare professional team about that because they're afraid that they might be taken off of their therapy, but in fact, that may not be the case. The healthcare team may be able to work with the patient in a way that would just help optimize outcomes, in a way that wouldn't have to come off of the drug, but then in a way that you can be healthier going through your particular cancer journey.